Okay, great. Good morning, everyone. Thanks for joining us. My name is Kelly Caseman. I'm the Executive Director of Think Kids, and I'm happy to welcome you to the Health and Hunger webinar. This webinar is the final webinar in our 2021 Health and Hunger Summit series, where we've taken a candid look at connections between the healthcare system and community resources that address hunger. For this webinar, we've invited previous panelists from this series and members of the House of Delegates Food Insecurity Workgroup. I will introduce all of them in a moment. You can find more information about the Health and Hunger Project on our website, www.thinkkidswv.org, on our Facebook page, and on our YouTube channel. I've dropped 2 links in the chat box. Both are links to issue briefs that we wrote in 2020 and this year's series brief as well. You can download them or request hard copies of these reports. We hope to continue these discussions because now more than ever in this moment, we need to unite in our efforts to ensure all West Virginians are as healthy as they can be with access to healthcare and nutritious food. Attendees, you have the opportunity to share your thoughts and ask questions by typing them in the Q&A and chat box. So go ahead and type them when they're fresh in your mind if you'd like, and we'll get to them towards the end of the webinar. We'll get underway by thanking our main sponsor for the project, the Palatine Foundation of Huntington, for their generous financial support. Here is our agenda for today's webinar, which is pretty simple. I'll introduce our panelists and then begin with a series of questions that we've prepared. The conversation may flow organically, and if it does, that's great. We don't have to get to every pre-written question, but we do want to ensure that we stay true to the topic itself. If panelists have a response to a question, we'll give them the space and opportunity to respond. But of course, not all panelists will have answers to all questions. So we'll move on. Regardless of whether we have more questions to ask, we'll save the last 15 minutes or so for your questions, attendees, if you have them. So we'll begin with brief introductions. Many thanks to those of us who joined us today, and I'll introduce them in alphabetical order. And our panelists are welcome to share more about themselves and their work and communities as the conversation progresses. And so I'm not sure everyone is here. I see 10 panelists listed. So I'll introduce everyone I have on my list. Chad Akers, I see there with Hungry Lambs Food Initiative. Dr. Anitra Ellis with Coalfield Health. Kevin Haw with Mountaineer Food Bank. Delegate Joshua Higginbotham. I'm not sure if Delegate Higginbotham is with us yet. Delegate Ed Evans. Delegate Riley Keaton. Mark Linville with Boone Memorial Hospital. Delegate Chad Lovejoy. I see him up in the corner. Dave Roberts with WVU Extension. Michael Tierney with Step by Step. Delegate Danielle Walker. And Delegate Lisa Zukoff. I don't see you on yet as well. Oh, she's on the call. Wonderful. Okay, great. Let's begin with a question that's open to any panelists who would like to respond. How would you describe the state of health and hunger in West Virginia right now? That's open to anyone. Chad, I see you're on mute.
Yeah, okay. You know, being part of the food pantry that I am here in Logan, we have seen a great increase in the number of families that we have served over the last several months. Well, really over the last year due to the COVID pandemic. So, you know, hunger is a huge problem right now, especially in the southern part of the state in our area. You know, I can't speak for other areas of the state, but, you know, Anitra, you know, with Coalfield Health on here, they are a big help to our program, and I know she will probably agree with me that in our area, hunger is a major issue.
Yes, I can agree with that, Chad. And you know, the thing about it is where we've had some success is we tried to combine the 2 things. So we've tried to bring our health stuff to Chad's group, so we can, you know, reach patients that way for those who cannot reach us. And then, you know, they're good about giving our information out to those who may need it. So as far as health, like right now, during the food pantry, we've worked it, but we've also taken vaccines there. So people would have that opportunity to get those. But health right now in West Virginia, we know that we're already at the bottom of the country in health. just regular health statistics, diabetes, heart disease, cardiovascular disease. It's just, and right now it's just not getting any better. I think what we have seen though is that if people do have the proper food, that they will eat it. So I think it's just all about educating and getting the right resources out there to them.
I'll pop in. This is Michael Tierney with Step by Step. I'm masked because, thank goodness, Logan County Schools has put in a mask mandate at their school system, and I'm here between meetings with administrators here today. My perspective, we have 19 after-school sites across Lincoln, Logan, and Kanawha County, and what I'm seeing is how deeply complicating the pandemic continues to be around hunger issues. The schools, the bumpy startup for schools this year, particularly until the mask mandates went into effect, have whole classes of kids quarantined. I don't know a school that has consistently been able to have all the kids there. So every time a batch of kids have to stay home, all those kids who depend on breakfast and lunch are not getting breakfast and lunch. With the mask mandates and the way things, I am praying that the state figures out a way that we continue to do some contact tracing. They're not going to be requiring quarantining if there's a positive case at this point, assuming that the mask will reduce that. Well, we know it's not going to fully reduce that, particularly with kids and the way this is spreading among kids. So I think we have a huge issue of kids who are going to be further food insecure because of how uneven their attendance is going to be because of family health issues. It'll be less if the school shuts down, but there'll still be school shutdowns. But I think that we've got to put on the burner, how do we address making sure that if kids do have to quarantine because there's been a positive case at home or something, that we still figure out a way to get them food. Because during the pandemic, step by step, we must have served 70,000 meals delivered to up and down the hollers in our first couple of the first 6 months of the pandemic. We have a lot of families. People are not addressing that we're still going to have gaps in services. The COVID relief funding that flowed in the first year of the pandemic those kind of grants aren't available anymore. And so I think that's a front and center. We've got to look at the patterns of how often kids are not at school getting the food that they depend on.
Just want to touch a little bit more on a little bit about what he just said as far as the children go. I have a friend who is a teacher at Logan High School who is also a minister and runs a food pantry himself. My son is a senior at Logan High School and has, I call him Reverend Godby, for class. He does a program where he sends backpacks home every Friday with kids from Logan High School with food because they don't have anything when they get home. And my son told me about this. So I have talked with Mr. Godby, and we're going to start helping him with that because he is sending home 99 backpacks from children at Logan High School. And, Logan High School's numbers are not what they used to be. I mean, we're talking, there's only maybe 600-700 students in the school. So when you have 99 kids that are being sent home with a backpack full of food for the weekend, it's a great thing, but it's too many. And we need to do something to solve that problem.
Yes, I think the majority of our schools in this area have different churches that cover them. So they all, have food for the weekend. But think about it. It's just that kid. Think about all the people in their home. So are they even getting, to consume the proper amount of food that's being sent home? Or are they having to, split it with siblings or parents or aunts or uncles or grandparents? So, we definitely want people to eat healthier. But right now, we just got to get food to people, I feel like.
Right, especially in this moment of the pandemic, which we'll get to in a few questions. Let's move to the second question. I've gotten to know a number of you community panelists here as we worked on the Health and Hunger Project this year. All of you seem well entrenched and engaged in your community. So how would you describe your relationship with your communities? And do you think this sense of community is essential to addressing health and hunger at the local level?
I guess I'll start again here. We at Hungry Lambs are very entrenched in the community. We have numerous partners. I spoke about Anitra and Coalfield Health. Pride of Logan County works with us. We have the Prevention Coalition that we work with. our quick response team in Logan. A little bit about what we do with the quick response team. We were very fortunate enough that the Palatine Foundation awarded us a grant within the last year. And with that grant, what we do is we put bags, actually duffel bags together that is full of food, water, Gatorade. There's personal hygiene products in it, socks, and information on what a person would need to do if they need substance abuse help or if they need food. There's different phone numbers they can call to help us. And the quick response team goes out on these calls, when they go to see someone that has overdosed, that has survived, and try to reach out to get them into treatment. They take those bags with them. And it's just kind of a way, I guess, for lack of better words, to break the ice with the person, that they see that they're not there to arrest them, they're there to help them. And by giving them those bags, that kind of gets them into a trust issue where they can trust the person, and it helps them get into treatment and do what they need to do. So, I mean, we just have lots of community partners that we work with. And to me, that's the only way that you can do this and make a difference, is to be trusted in your community and have as many partners within your community as you can have.
Chime in, Boone Memorial Hospital, obviously we're in the healthcare industry, but we also recognize the need to feed the hungry and to do what we can. When we did our panel, I discussed our pharmacy program, which is FARMACY, pharmacy, and it is through the W Extension Office. And we've recently started that program back to where, if there's someone in our community that is needs food or whatever, they can see their doctor provider, and they will refer them to this pharmacy program, and they can come by and get fresh vegetables and healthy food and things of that nature that helps. I think one thing that we need to not only address about hunger, we need to feed the hungry, but also the food that we give needs to be nutritious. And if we're talking about health and hunger, food alone, and a lot of times we want to give out foods maybe that are high in sugar content or starches or things of that nature, but we need to be sure that we're giving healthy food along with feeding the hungry. And I applaud Chad in their effort in their QRT program. We as well have a QRT program in our substance use disorder program, and we're finding a direct correlation of substance abuse with hunger as well. I know many have discussed the school systems and the needs there, but obviously a lot of our problems in our community are due to substance use disorders.
I'm Kevin from Mountaineer Food Bank. Just to speak a little bit about what the food bank is doing, we have programs all over the state that we are focusing our attention, not of course on hunger, but basically trying to make sure that families have access to fresh produce. Not only that, we want to give them recipes and things to help them learn how to prepare these type of foods. When you come from a poor community, which I grew up in the Coalfields of West Virginia myself, you can find bad food for you really cheaply. So we at the food bank have been sourcing food from all over the country, trying to get these better resources and set up programs. We just recently got a grant through Palatine that we're actually going to be giving boxes at a couple of the health clinics here in Kanawha County and in Boone, which we can serve. But not only food boxes, we want to add a nutrition component to it. So we've been blessed to be able to start a few new programs around the state. Our backpack program, we send backpack all over the state of West Virginia. We got to take care of our children. And I think a lot of the things that we're doing at the food bank is focused to teach our children how to use the food that they do get in those backpacks. We try to provide them with items that are pull tab, easy things that don't call for preparation. A lot of our kids are going home to parents who are at work, and they have to figure out these meals themselves. So we're trying to make sure that we are doing things that can help a younger kid be able to still maintain a good diet. So those are the things we're doing here at the food bank.
Okay, let's go to Lisa Zukoff, Delegate Zukoff, because I believe she's had her hand up. I'm not sure we'll be able to hear her though. Lisa?
Can you hear me?
Yes.
Okay, perfect. I think being involved in the community is critical. In our local community, the FRN and our Family Resource Network and our Family Resource Center serve as an ideal core connection to the rest of our community. Through that, we have a Hunger Doesn't Take a Summer Vacation food drive every year. And the pandemic changed that. So we've been able to raise $10,000 to $12,000 the last 2 years. And we give that, then we reach out to the local food pantries, and we know that, we give them cash so they can get exactly what they need. And I think that's the way we'll continue, rather than having people donate the food. And then we have to, it's much more manageable to give them the money and let them buy what they need, rather than have people donate. And then you have to, break it up into boxes and give it out to the different areas. And I think it's been, we've had a few through the Mountaineer Food Bank. Thankfully, we're very thankful for them. There are some programs that have been started in our school system. We're having the farmers markets when there's fresh fruits and vegetables available. The Mountaineer Food Bank gives the extension folks the food, and they hold them in our local schools. And additionally, we have a resource called Grow Ohio Valley in the Northern Panhandle area in Wheeling, and they've been going into our school systems as well and teaching the kids. They have raised bed gardens that they've put in at the schools, so they're teaching the kids and then providing seeds when spring rolls around through the extension service, so the kids can actually grow some of their own fresh fruits or fresh vegetables in the summer. Having worked some of the food pantries that we've had locally in the last several years, it's come to my attention that we have much more of a senior citizen issue with hunger than I ever understood there to be in our community. I think it's wonderful we focus on our children, don't get me wrong, but through the food bank, when folks come through the line, I was registering people several times over the last year, and you have to ask them, do they receive SNAP benefits? And I can't tell you how many seniors went through the line and said, yes, $19. That's how much I get. $19 over and over and over again. And these folks share the things that we already know, that, sometimes they have to make a choice. Do I buy my medicine or my food? And when the food banks are out there giving out healthy food, they come through because they need that resource. And just one last thing, because there were only two counties in the state that did this, Marshall County, and I believe it was Harrison County, but they actually had a meal delivery program. And because we have a lot of our county is rural, and trying to get the kids the food they need in the summer is a real difficulty, as it is all over West Virginia. They actually used FedEx to mail boxes weekly to the school, to the kids that needed the food. And I can tell you, I've asked the Department of Education to do a cost analysis on how much more or what did that cost versus having people prepare the food and then getting out to the kids at the schools, because we know that getting those boxes directly into the homes makes a huge difference. So those are the things that I've learned by being out involved in the community. Thank you, Kelly.
Thank you, Delegate Zukoff. I believe Michael Tierney. Oh, go ahead, Delegate Walker. Then we'll put Michael on.
Thank you. I agree with Lisa wholeheartedly. I shop for 14 seniors using their SNAP benefits, and it's a process. It is a trust builder because I have to do things in order. So being their proxy, so I can go to the store and use their EBT cards. And then there's that stigma because I'm swiping so many and I am separating the groceries. Shopping for 14 seniors and I still don't have one basket that's full, that's a problem, especially when they're grand families. They're taking care of individuals that's not in K through 12 schools yet. So they're not getting those meals from the schools. And they don't know how to report this to DHHR without causing hurt and pain to their family member who may be dealing with some type of substance abuse disorder. So I think what I've also learned in the community, just as we stop saying the homeless, we need to stop saying the hungry. It is folks that are facing hunger. It is folks that are dealing with food insecurity. And we are the folks that are fighting for food justice. Thank you.
Thank you, Delegate Walker. Michael Tierney?
Just to pop in real quick on this, I want to really play up after school programs and working with the Office of Child Nutrition as a key strategy for dealing with this. They found a lot of flexibility during the pandemic. We delivered home learning packets, and that counted sufficiently for us to be eligible for the after school supper and snack programs. So with this ongoing crisis, I think it's worth really exploring how much those federal funds could be stretched. They're also, we also run 16 mentoring programs through those after school programs, mostly middle school and high school. 66% of those kids are not living with their biological parents because of mostly opioid epidemic issues. And so again, after school programs could be a key place for partnering with food banks to be able to get food to those grandparents and aunts and uncles. So the delivery system's there. We drop the kids home after school. So I think there's a multi-tiered partnership to get food to everybody in those families, recognizing that Office of Child Nutrition can only cover people from 0 to 18, but there's real potential there. And I'm shifting to phone because I'm going between different school meetings, but that's me down with the 3280 and I'll still be on board.
Great, thank you, Michael. Dr. Ellis?
I was just going to say, I think what we've learned the most by being involved in our community, I work for Coalfield Health, but we're a part of a group called Wild, Wonderful, and Healthy Logan County, which has Logan Regional, it has Coalfield Health Center, it has Pride. What I've learned is there's a lot of people trying to tackle the same issues in our community with, hunger being one of those things. And when it comes to health, it's not just a food thing. We have to look at physical activity. We have to look at comorbid conditions and stuff like that. So being in the community just allowed us to be able to partner with different community partners to address the issues, because like I said, a lot of people are trying to address the issues. And when we combine our forces and try to reach people that way, I seem like our sources always go a lot farther.
Wonderful. Thank you, Dr. Ellis. David Roberts.
Yes. Thank you. And just want to say, working with Extension and hearing some of the partnerships that have already been mentioned with, some of the pharmacy programs, some of the offering seeds in the schools and having some of the community gardens. We do like to work with our local food banks and actually host some of those cooking classes to see whatever they have in that weekly box and how they can make it. But, a couple comments as we was listening, I really want to thank Delegate Walker for mentioning it. But, the way we kind of talk in reference of not necessarily the hungry, but those facing hunger, because, some of the components we try to do with our schools, some of the school gardens and school-based interventions is any of the produce we may have it also a portion of it, at least either classroom tastings, but a portion of it going to the local food bank so we can have that conversation with our youth, with our students of kind of contributing, having an honest conversation of needs in the community. So it's not always also just somebody else that's kind of helping, but, we're all kind of in this fight together. And was also very glad to hear the connection with our senior citizens. We have a Calling Communities program where we're partnering WVU students with seniors across the state to kind of just have some weekly calls, connections, conversations. And, we quickly picked up on there's a lot of our senior citizens across the state that are hurting. So, just being able to have those resources on hand that we can hand them as those come about. Like I said, that just a couple thoughts that came up as we were talking there.
Thank you, David. I'm going to skip to another question before we resume with our normally scheduled questioning, because we've been talking about the need to address senior issues, and one of the things that became really prevalent, and I hope some of you can speak to this, during the first wave of the pandemic, is that many of our food pantries are operated and cared for by senior citizens. And so we had people, I believe Chad, Chad's mom, for example, was one of those senior citizens. And what we found was, part of a really important part of that infrastructure is being run by volunteers who are older. And so it was really concerning to their health at a time when we needed to feed more people. We really needed to be caring for those people, volunteering their time to care for their community. And something that came up during our series was that, how do we get better at bringing our high schoolers who need those community hours, right? And those college students who need the same to volunteer in our pantries. How do we make those connections? And also it gives them an opportunity to realize, to build more of a connection with their community, to realize some of their community needs. And so it seems like a really great idea, but we don't see a lot of folks working on this. And I see Delegate Keaton, would you like to respond?
Yes, ma'am. Thank you, Kelly. So I came about this information just in kind of a strange way, that I have a little cousin who just graduated from Perry Schools right outside of Cleveland, Ohio. And, a lot of my professional background has been in working with what used to be High Y and the Youth Leadership Association on school-based service organizations. So I kind of thought that I had, I've gotten young people involved in working in sort of the food bank scene before. And then she comes to me, my little cousin, and she explains that as a senior in high school, if you have your license and if you drive a car to school, they offer like credit toward graduation for during a specific block of the week to go and work the food bank. That was something that I just thought was an incredible leveraging of, school time that they're already obligated to, sort of being productive, if you will, and sort of leveraging it into helping boost the volunteer ecosystem for food banking. So I thought that was very intriguing, and it's something that I've brought up to Delegate Pack, one of the co-chairs on the House Hunger Working Group. And I just wanted to share that with you, that I like the idea of offering for-credit service opportunities to high school youth.
Wonderful. Thank you for sharing that. Anyone else want to share? Chad?
I can touch a little bit on this subject. As you said, my mother was one of the, and she still does come and volunteer, but at the age of 75, she was one of the youngest volunteers that we had. And that's kind of how I got involved with it. The majority of our volunteers before the pandemic were ladies that were in their 80s and even in their 90s that still came. So of course, when the pandemic hit, it was way too dangerous for them, because at that time we were doing basically like a walk-in food pantry where they could walk through and just pick up items and put them in a bag. So when the pandemic hit, of course, we had to change it to a drive-through where we load everything into the cars. My wife is the director for the Southwestern Regional Day Report Center here in Logan, which covers Logan, Boone, Lincoln, and Mingo counties. And they have a program that is called the Fresh Start program within the Day Report Center. And what that is it is a program for people that are in recovery. They do job training. There's all types of different classes that they do. They do certifications, like we have some of them now that are certified to run a greenhouse, which I'll touch on that in just a second. They have been trained on being able to remove asbestos, because here in Logan, there's a lot of buildings that need torn down, but there is no one in Logan that was trained to remove asbestos. So they would have to contract either out of state or out of the area people to do. So it's bringing things like that, getting them back into the workforce. They have been my volunteers since the pandemic hit, and we couldn't do it without them. I mean, they are amazing workers. And honestly, a lot of them are people that need the food also. And so of course I make sure they get it before they leave, but it has just given them a sense of pride that they are able to do something now to give back to the community that they have lived in and some have taken from. over the years. And along with them just helping there at the food pantry, touch on something Mr. Roberts said a minute ago about the local community gardens and things like that. I volunteer with the Fresh Start program myself, and we have a community garden, which is just probably 200 yards from our food pantry, where not only do we raise vegetables, but we have a chicken coop with about 100 hens that we collect the eggs, the vegetables, and it is all taken and donated to the food pantry. So we're able to give fresh eggs, fresh vegetables. But, you know, along with the fresh vegetables in the garden, you can only grow that so often. So we were lucky enough, Anitra just a few minutes ago mentioned the Wild, Wonderful, Healthy Logan County. They were able to get us the money to purchase a 20 by 60 greenhouse that we don't have yet. It is ordered, should be coming in, that we'll be able to put on site at the Logan County Resource Center here where our food pantry is. So that way we will be able to grow fresh vegetables year round for the food pantry. We do have one problem though. We need help getting that greenhouse erected. So if there's anybody on here that knows anything about it or can offer us some assistance, because it was going to cost us $30,000 just to get the greenhouse built, and we can't afford that. So we're looking for any volunteers or anyone that can help assist us in getting that greenhouse built when we get it in. But you know, it is a great thing to use the programs like that, like the Fresh Start program and the volunteers that we get like that. It has really helped them with working in the food pantry. People have seen how hard they work, and I'll be honest, I'm losing some of those volunteers right now, but it's a good reason I'm losing them. They are getting jobs now, and most of the reason they are getting these jobs is because of the work that they have done with the food pantry. Because we get other volunteers that come in that are business owners and things like that, and again, like I said, they have seen how hard they work and they are hiring them now. So that's a great thing. So the food pantry helps with people that have substance abuse problems and we're getting them back into the workforce now.
That's wonderful. Thanks, Chad. And I was speaking with the folks at the Palatine Foundation of Huntington who said they came and volunteered with you one of the days not too long ago, and that
they work their butts off, and we appreciate every minute they were there.
Yeah, well, you know, they were saying that, you know, and this is something I hope we can touch on in a little bit about transportation, but you had people driving up and saying, you know, they were picking up for like 12 families. And when you think about the fact that many of our volunteers are seniors, you know, those boxes are heavy, you know, so trying to accommodate these families, knowing that our volunteer base is older, you know, so I think it's a big consideration. So I think that what you all do partnering with the Fresh Start program is a really wonderful idea. That it would be great if other counties or communities could synergize all of these different efforts into this.
Just the stigmatism of people that are in substance abuse needs to go away. They are just like us. They come from all walks of life. It doesn't matter. You know, we talked about homeless. It doesn't matter if you are homeless or if you live in $1 million home. You are not immune to the drug pandemic. It is a disease that can affect anyone. So we need to get rid of that stigmatism that because someone's on drugs, they can't be any good. I can tell you so many success stories, but you know, we don't need to go into that, but everyone needs to take advantage and help the people that are in recovery, and you know, they're great volunteers to help with your food pantries or whatever you need.
That's great. Thank you, Chad. And you're getting some accolades on that and some validation from attendees who agree with your point. I'd like to jump to the next question for our legislators on the panel. All of you agreed to serve on the House of Delegates Food Insecurity Work Group. Tell us why you wanted to join the group and what ideas or concerns brought you to take on this issue. Delegate Lovejoy.
Thank you, Kelly. You know, this is something that started really several years ago. Up at the Capitol, there are lots of groups, and groups in legislation get special names called caucuses. So there's a coal caucus and there's a labor caucus and there's all these caucuses, but there was really nobody talking as a group about food insecurity. We had pockets of people, but we didn't have kind of a concerted effort to have a common dialogue. So in about 2017-ish, somebody mentioned that another state had at what they called a hunger caucus, bipartisan, brought people from all over the state, all parties, and we just talk. We don't talk politics. We just talk again, an equal opportunity issue of food insecurity. And so that went on for a couple years, and we tried to get together and put together some legislation. And we had some real successes with a few bills, Fresh Food Act, the shared table. And so as we move forward, folks said maybe we could take this kind of to the next level and have an organized. Not necessarily a committee, because with a committee you have some constraints on how and when you can meet. And so we have this thing called a working group. So a couple of us approached Speaker Hanshaw, who's been a great friend to the previous efforts. He's from Clay County, certainly a rural food desert situation he has. And he has a background in the FFA. So he comes at it from both the insecurity side and the farm side. And we said, hey, what do you think about this? And without hesitation, he said, absolutely. And so he said, let's get together some people. And, I'm proud today. We've got Delegate Walker, we've got Delegate Keaton, Delegate Zukoff here, people that have shown a real personal interest in this. And we got together some great minds, and we said, let's try to work through this. And we're not naive enough to think that 12 people can solve an age-old problem, but we are committed enough to believe that by listening to the experts, the people in the trenches, and Delegate Walker has always made a good point, listening to people that are suffering with food insecurity, to understand the process, the barriers, the things that get in the way of connecting the people to the food, we can maybe make a difference. And so we're meeting about once a week. We're finishing up kind of an education part right now. We've heard from DHHR, Department of Agriculture, Department of Education, kind of about the programs. We've talked with our food bank partners there, Mountaineer, and I'm here at Huntington with Facing Hunger. I think Cindy's on the call. And so we've tried to listen to the people that are doing the work and tell us, how can we be better in policy? And we're getting now ready in the next week to transition to policy discussion and drafting. And we're trying to put forth I don't call it a slate, but a list of policy provisions that can move the needle on food insecurity. Secondarily, we want to be advocates. And so we want to be able to speak with a common voice, whether it's to advocate for changes in executive agency policy or to advocate to our federal counterparts on many of the federal programs to say these are programs and ideas that greatly impact West Virginians who are suffering. And so, we implore you to make changes that'll help. And so I'll say that I would like any and all of you that are on the call, if you have specific ideas, please get them to us. You can send to Delegate Walker, Zukoff, Keaton, myself, get them to Kelly and she can get to us. But please get us your ideas and let us think through that and try to be a resource for you.
Thank you. And we certainly, so over the past few years, we've kind of built a database of supporters, and anything that you wanted to shop to any of these folks who work in these, fields around the state, we would be happy to do that. Delegate Keaton.
Thank you, Kelly. Really good job, Chad. I came at this a little bit later than Delegate Lovejoy, working from the ground up for years on things like the Hunger Caucus. I was elected this most recent November, and Delegate Larry Pack had asked me about my interest in serving on the House Hunger Working Group. And really, when I got to thinking about it, it made all the sense in the world. My high school job was on a summer feeding site that taking care of youth opportunity campers ages 7 to 12 at Camp Horseshoe. I continued that work through college. My mother is like a chronic volunteer, if you will, at at the food bank here in town and also across the county line in Calhoun County, doing some really, really great work with those folks. She built the community garden at Arnoldsburg Elementary is her pet project that she accomplished during her time there. And the church that I'm involved in, that I attend regularly, is sort of the big food bank sponsor, if you will, host site in Roane County. And I really think that the key to hunger policy is that we've got all of these other things on economic development, on education, on healthcare, on what have you, but like all of it requires people to not be hungry and not be chronically hungry in order to realize all of the potential gains you can get from economic opportunities moving into a community, from educational opportunities moving into a school. So I think I come at this, and really what I'm excited to bring to it is just sort of somebody who's passion is in getting people involved in the issue, helping young people address the problem, themselves get involved and actually address it in their own right, and just making sure that all of the other work that goes into legislation, that goes into every other area of policy, can kind of sit on a strong foundation of plentiful, nutritious food for everybody that needs it. So thank you for inviting me this morning, and I really appreciate the opportunity.
Thank you very much. I see Delegate Zukoff's hand is up.
Thank you, Kelly. And I will Chad, great job explaining our role and how we got involved. I've been involved in my community for many, many years before I got into politics and became a legislator. And I know that for me, it goes back to having some food insecurity as a child. We weren't dirt poor, but there were times we ate a lot of oatmeal. I'll leave it at that. So I know that sometimes starches are some of the things you can buy cheaply and make things work. So having experienced that myself and understanding that, food is a basic human need. As Delegate Keaton just said, we can't get on with the rest of our lives. We can't learn, we can't work. It's really hard to be a productive member of society if you're hungry. So I think that it's really meeting that basic human need so that our West Virginia citizens and children can function in the best way they can to become productive, to be educated, to get a good job. All those things are based on feeding people. That's why I became involved, and I'm proud to be part of this group. Thanks for asking me, Chad.
Thanks, Delegate Walker.
Yes, so I guess it's a little different for me. I was honored and humbly honored to be a part of this group because it's not often that you have all the stakeholders at the table. As you've heard my colleagues say that they were volunteers in several pantries. Well, I was a recipient in my community of receiving that. Hand up with many pantries. I was also blessed because in my neighborhood, I was the only one with a vehicle. So I would bring 3 other families with me. And we would have one certain day that we could go to the food pantries before both of my boys got sick and my mother got diagnosed with stage 4 breast cancer. Then it became an issue where pantries are only open at certain times, but if I have one going to chemo and the other 2 going to physical therapy, I would miss those days. My mother and my sons never had to deal with hunger, but I did by surviving off of sugar water for 3 months. Yesterday, we had a meeting with our work group, and there was a prominent statement that was made. Good food is good medicine. Because of that abuse, not intentional of my own, I became a diabetic. We have food insecurities even working at the Capitol. When you look at our community, at our committee work list, on Wednesdays and Tuesdays, I would not have a chance to get anything to eat if my youngest son wasn't with me that week of running to the cafeteria. And even there, It's not often I have much to choose from because I became a diabetic in 2020, an insulin dependent diabetic. So it's a little bit different from me. I take the voices of my community. I elevate my community. And I'm so proud of my county because now we have different food boxes throughout our county where it can be accessible for someone who is working, someone who is on a ride that may just be able to stop by there, someone that could walk to the edge of the road and get what they need. I appreciate each and every one of our efforts, but as someone said earlier, we still have many disparities. So I am proud and I'm not ashamed, and I don't need you to pity me. Together we will get a solution to make sure not one more West Virginia, not one more Mountaineer has to endure what many has. Thank you.
Thank you so much for sharing that, Delegate Walker. I appreciate that. And that's a good segue to another question that's open to everyone. From your personal perspective, what is the biggest challenge we face to improving access to healthy food in West Virginia's rural communities?
I'd like to state one thing that came to my attention that I was unaware of, and this happened during the pandemic. You know, Boone County is kind of unique in the fact that our county is divided. We have what we call the big coal area and the little coal area, and I live in the little coal, which is in Madison, which is our county seat. And there seems to be a lot of programs that's going on in our county. My local church that I attend has a food pantry. Like I mentioned before, our hospital's doing a pharmacy program. There's other food programs. But during the pandemic, we would go out and do regional vaccine clinics. And one of those was held over on the big coal side. And many of the health departments, local EMS, everyone participated in these vaccine programs. And someone would be kind enough pretty much every week to buy lunch for the entire vaccine crew. At the end of the day, we had a lot of food left over, and we would start this process of, would someone like to take this extra pizza? Would somebody like to take this extra food? And there was always someone from over on that side of the county who would say, I know a lot of families that could use this. Let me take it to them. Well, also, Boone Memorial has recently opened up a new clinic over on the big coal side, and we had a meet and greet. Again, we did hamburgers and hot dogs and food for the community. And at the end of the day, had food left over. And the lady that owned a pharmacy over there came and said, I know people that can use this food. So, I guess from my lack of knowledge in this, I always felt that Boone County had some pretty good programs until I realized that geographically our county is challenged because we have two separate populations in essence. So what I've learned is the big coal side of Boone County not necessarily receives the food services that this side of the county has. So that's one thing that our local hospital would like to address at some point, and maybe working with the delegates. Part of my job is legislative and government policy. So I'm looking forward to meeting with you guys, and maybe we can come up with a solution how we can combine the different geographic areas of our county to meet the food insecurities.
Thank you, Mark. Anyone else want to share the biggest challenge?
I think one of the challenges that we are facing at the food banks is transporting food to those smaller communities. We're limited in the number of trucks and the ability to keep things cold. And when it comes to fresh foods, you have to have refrigerated trucks. So what we've tried to do is start a lot of miniature type of transportation, hitting smaller communities with smaller vehicles, spending more time in those in those communities, to try and feed people where they are. A lot of times, our larger mobiles, you have people that may travel 30 miles to get a box of food.
Yes, hey, buddy. I'm
Feeding
right
Families
here.
Prime program that we started, where we, with the help of our state delegation, they have given us money at the food bank to take and start these fresh initiative pantries in communities. Not only that, they have programs that go along with them to talk about dieting, exercise, meal preparation. So we're striving to get into those places. And it also takes up the buy-in of the community. And the only way that we know that we can do that is actually be on site in those communities. So, get to know the people, get to know what they're doing, and have them buy into the programs that we want to start. So I think that's one of our biggest challenges.
I kind of have to agree with Kevin there. Like he said, getting the food out into the areas where it is really needed the most. We noticed that when the pandemic happened, that a lot of our seniors have not been able to get to the food pantry when we do distributions. And we had no way of getting the food out to them where they needed, where it needs to go. Just recently, thankful for Pride of Logan, they actually just donated us a small Chrysler van. They got new vehicles. It's an older van, but they just in the last couple of weeks donated it to us. We finally got insurance on it, getting it licensed, and it's going to be a situation where we will be able to deliver some food to seniors that can't get out, but it's not big enough for us to really get out there and do what we need to do. So that's one of our goals is, and like Kevin said, getting the right trucks, the refrigerator trucks, so you can haul the fresh vegetables and things that need to be kept cold. We are looking into trying to purchase a large refrigerator box truck. So because as Mark said, with Boone County kind of being spread out, Logan is kind of in the same situation. We have a lot of areas that we need to try to get into. And so if we had a larger box truck that's refrigerated, we could go out throughout the community throughout each month and set up in certain areas where people that can't really get to our center when we do the distributions, that it'll be a whole lot easier access for them to get to us. Instead of like driving 30 miles to get to us, they can drive a mile to get to us. So that's some of the things that we're working on here.
Thank you, Chad. That reminds me, I don't see Michael Tierney still on here with us, but he told us during the series, when you live in a very rural setting with a lot of mountains and, even just if it's 10 miles down the road, it becomes incredibly difficult for somebody who lacks transportation to find a way. Even when you're talking about distributing food to families when school's out, and you can just take it to the bus stop. You have families who are needing to walk miles just to get that food box. I'm sorry, Kevin, were you going to say something?
Well, I wanted to just mention, along with what Chad was talking about, and I wanted to tell everybody here on this call, we have some wonderful ideas that our pantries have given us. I don't want to skip out on the things that some of our pantries are doing. For example, in Mon County, we have now one of our pantries is doing door deliveries. People can order boxes, and I think that they're feeding 25 to 50 families. The thing is, we have to start somewhere. A lot of times when our pantries, we want to, feed 100 people. If we can get 10 up in those hills and hollers fed, 10 families get the support that they need, then that's 10 kids who are going to school able to learn, 10 kids who get to grow up and not have to worry about food being their issue. Some senior couple doesn't have to worry about, do I buy my dog food or do I buy myself food? Or do I pay my medical bills? You know what I mean? So we're trying to address all of those, and don't forget those things that we can help. What we try to do at the food bank, we have hygiene products now that are coming out of the food bank. We have clothing that's been donated that is part of the things that we give around the state. These things help eliminate the cost of buying other things to compare it to food. So we're working on it. Got a long way to go, as you guys said, but it's something that we're facing.
Thanks, Kevin. Anyone else want to weigh on what they believe is the biggest challenge?
I'm going to jump in here, Kelly. I think sometimes when we have different programs, I've seen it because we've lived in HUD housing. When seeds are sent home, we could never grow the seeds. It was against our lease.
Oh, wow.
That front lawn did not belong to us. We could not have potted plants on the windowsill, or that was a write-up, which could lead to an eviction. So I think one of the disparities are, I see everybody, shaking their head. That's the reality of some folks. And even though it's good for some, then it brings some anxiety to the students. They don't even bring it to whoever that parent or that guardian is in the house because they rather have that roof over their head. When we look at disparities, we look at the food deserts or the food swamps. We look at transportation. You can even look at how many jobs a person is working, because even though you're working, it doesn't mean that you're still not hungry. A lot of people feel comfortable in asking another, can you please pick up my food at the pantry this week? The pantries are doing a phenomenal job in allowing that to happen. But the stigmas and the biases that we put around food, even though we need it to survive, we don't have a right to food in West Virginia. It's not part of any federal constitution. It's not part of any state constitution. So it allows for us to have those negative connotations when you say, I need food. And so I think educational program also would be phenomenal, starting with the K through 12. And so when they get to that age when they can volunteer in the pantries, that would be phenomenal. Because if I don't have a vehicle, I don't have a vehicle at home, but if I still don't have a vehicle, then I still can't get that credit, even though I want to be part of this. And so if we can get maybe the school buses or public transportation, but we live in West Virginia, not every county has public transportation. And, are we even speaking to those counties that does have, transportation? Can you be patient when we have food pantry days? It's going to take that grandmother with those 2 grandbabies a little bit more time to walk on the bus with what she's receiving. Can you be patient when you put her down at that stop? So I just think of those things. Thank you.
Wonderful points. Thank you for sharing. Anyone else want to discuss the biggest challenge? Okay, let's move on. So we know that there are incredible challenges right now, especially since we're facing another wave of the COVID-19 pandemic. So how has the pandemic affected your organizations? Do you feel that you're working at capacity, or are you continuously expanding to meet the needs of your communities?
I do think I've always said we work with a moving target, but this has really threw up several moving targets of being able to know how we're meeting our, the needs of our communities. We have been able to push a lot of our programming virtually, which has a lot of mixed results, whether or not, are we being as effective and bringing that personal connection, or are we able to reach everybody? So as we're starting to, or we're beginning to start back into some of the more of the face-to-face programs, I do hope we're able to kind of keep that blended, because we have had some success, I feel, in our virtual delivery programs like our Dining with Diabetes, and ways to actually give demonstrations and show individuals some different recipes that are diabetic friendly, kind of have an Appalachian flair, but are a healthier side. We're able to put that on a virtual format. And while I look forward to being able to hand a participant that sample that they can try, we've been able to do a statewide Dining with Diabetes, having participants from 22 counties in our last class. That was never possible before. So, like I said, as we push some of those programs forward, I do think this is helping us reach a broader audience. It's one of the benefits, I guess.
Thanks, David. Anyone else want to share?
From a different perspective, I mentioned earlier that our church does a food pantry, and actually what we, now I'm just speaking locally here. I can't speak regionally or statewide. You know, what we've noticed with the pandemic, obviously there's been a lot of government assistance and a lot of government programs that has given stimulus checks to people and families. And there's been different avenues of monetary security versus food insecurity. We have really experienced at our food bank at our local church that our giving of food is down. And actually our budget is very well funded right now. In fact, you know, we really probably, if there's people out there in need, we have a resource that we would really like to give to the community, but our demand is down due to the allowances of federal assistance during this program. What I'm afraid of is when this pandemic is over with, and kind of like David mentioned, going back to the normal processes, I think we're going to see our demands go back up. And that's one thing we probably need to be prepared for.
Thanks, Mark. That's an important point. And it brings up a question that I don't think we're going to get to, but we talked a lot during our session series that the problem isn't always that there isn't enough food, but it's the logistics of having to get the food to the people, and that sometimes there isn't fundings or mechanisms in place to ensure the capacity to do it. And so I don't know if anybody would like to speak to that, but I think that that's a continuing problem that, you know, perhaps there is funding in this moment to help address it, but it will continue to be a problem once the pandemic is over. Anyone else want to touch on that one before I move to the next question? Okay. One of the prevailing themes we heard during both years of working on the Health and Hunger Project is that there is no centralized infrastructure to address hunger, and importantly, lack of access to healthy food. Healthcare providers sometimes don't know where pantries or pop-up farmers markets are. Everybody is doing their own thing, which sometimes leads to duplication of efforts, and few cross-market their programs and services that they provide. In this environment, it's hard to identify gaps and prioritize needs. Would anyone like to characterize this further and offer ideas to improve collaboration? Chad, or Delegate Lovejoy.
Oh, thanks, Kelly. No, you're exactly right. And this is one of the things we've discussed is the concept of people are working in silos and working very hard and doing very good work, but sometimes there's not this cross-pollination. And one of the ideas that we've talked about, and it's an idea, I'm not sure how viable, although it should happen, is the idea of an office in the government, right? A central office of I don't call it like the hunger czar, but the idea that one person or department that is talking with DHHR, that's talking with the Department of Agriculture, with Department of Ed, working with our hospitals and working with, you know, the food banks, and then also working with our federal counterparts, so that we have kind of a central place where somebody has all the information, because there are instances where, say, departments, this department thinks that department is handling it or doesn't know that they're doing it. We have duplication of efforts, we have reduced efficiency. And so if we have somebody that says, hey, do you know this grant is available, and make sure that's applied for, and this grant's available, say federally, but also then in my dream world, and this is something that Dr. Josh up at the WVU Food Justice Lab has brought up, if we could have a coordinator in each of the 55 counties that kind of answer to the mothership and say, okay, here's what's going on in this county, and we would really, you know, have boots on the ground to work with our healthcare community, our food pantries, our food banks, and make sure that that those gaps are closed. And so that's certainly something that I personally intend to propose, and we'll see how the work group feels as a whole. But yeah, we've got too many people doing such great stuff, but we don't have things like this enough where I hear the wonderful things in Logan and in Boone and just everywhere. So I think we need to work harder on that.
Well, Chad, I agree with you 100%. And that was one of the topics that I brought up during my panel discussion. And that was, you know, I even learned, and one thing about being a panelist, also was able to learn, like, you know, talked about, we didn't have a centralized food bank here, but yet Kevin let us know that, Mountaineer Food Bank is available and they are coming down here. And what we have found out is exactly what you said, is we have a lot of great and wonderful organizations who are working independently. And when you're working independently, a couple of things happen. Number one, you don't necessarily get the information out to the public of where they can access the food. Number two, you don't know where these pantries are located. You don't know where the pockets of the food insecurities may be. So wonderful idea, Delegate Lovejoy, that each county should have a centralized nutritional advocate or person, whatever the title you may want to give them, to be that resource that all of the independent food pantries and people who are helping the hungry. We do a backpack buddy through United Way. We do food pantries at our church. We have other churches that bring in food truck. But yes, if we had one individual person in every county, I think that is a great and wonderful idea.
I have to agree with that also. And Delegate Lovejoy, I think it's a great idea. I especially like you talked about the grants and things that are out there. There's a lot of grants that I know we could apply for that we just don't know about. And again, we've been so thankful to the Palatine Foundation for the grants that they have worked with us on. Talking about centralized food pantries, food banks, where we are located is in the Logan County Resource Center. And thanks to the Logan County Commission, it's an old 84 lumber location in Logan. And I mean, it's just a huge facility. And I invite any of you all at any time, contact me if you'd want to come and tour the place, or even come when we have a distribution so you can see what we're working with here. And I know Anitra can tell you the same thing. It's an amazing facility. We have a satellite health department there. There's meeting spaces. We are in the process of having a commercial style kitchen put in there that I know you're talking about doing tastings and teaching people how to cook the items that we give them. That's a project that is in the works. So it's a great facility, and I'd be willing to sit down with anybody at any time if you want to come or have me come to you. I think it's a great idea, and Delegate Lovejoy, I really appreciate that. I think it was a wonderful idea.
David?
Yes, just wanted to add on that a couple of, projects that's going on. I believe Dr. Ellis may have mentioned the Wild, Wonderful, and Healthy Logan County and some of those initiatives. And, I am able to work with project through the West Virginia Center for Rural Health, which is connected with those. And, we have a team that's of individuals from across the state. We're going through the National Leadership Academy for Public Health project right now with the goal of putting together a leadership development curriculum that really addresses health inequities for West Virginia health community coalitions that are, a lot of the projects from Try This to the Greater Kanawha Valley Foundation projects have community coalitions as part of their, funding requirements. So really looking at a way to have a leadership development for those coalitions that talk a lot about what you're mentioning here with those connections in the communities and knowing what are available, because, with all health inequities, hunger is, those facing hunger is kind of the common denominator a lot of times, being able to have access to that healthy food. So, just as we move forward with kind of finishing and finalizing that, I look forward to, getting that out, but definitely want to encourage all to, check it out when we get it, when it hits your desk, hopefully soon.
Thank you, David. And Delegate Lovejoy, this is something that came up again and again during our series, is that there needs to be some sort of centralized effort. There are so many good things going on, but it depends on the community. And then you see, a community like Logan, where they're all coalescing together. And I'm hoping Dr. Ellis will share a little bit when I ask the next question about what she did. But just that proximity seemed to synergize everybody working together, and they could address so many things by that coordination. And to, if we could do that on a state level, that would be, I think, just be meaningful. So I'll jump to the next question because we're starting to get a little short on time, and I want to make sure that anyone in the audience, if you have questions, please put them in the chat now, and we'll get to them in just a few minutes. This question is for those of you who work in the healthcare field. So many of the health disparities West Virginians struggle with are directly linked to hunger and a poor diet. But we know that healthy foods aren't always available to many of us. Folks may live in a food desert or a food swamp, which is a place where only unhealthy foods are available, like fast food restaurants and Dollar General stores. So how much of a challenge is this, and should we be addressing it as a priority?
I can speak to that. We definitely have to make it a priority. I know here in Southern West Virginia, it's not just about kind of what you're eating, but a lot of people have the wrong concept with disease processes. So if there's a patient who's a diabetic, they think that they can eat whatever they want to and just give themselves the insulin and that's going to fix it. Or somebody with heart disease and, you know, the fatty things that they eat, they think that, you know, that's corrected by the medication that they're taking. And I think a lot of times in Southern West Virginia, those who are bigger or those who may have obesity are viewed as more healthy than smaller people just because of the way we think. But really, for us to have a healthy community, we have to address not only food, but you know, your disease process and then physical inactivity. That is so big, where people just, you know, don't get out and walk, or, you know, the only kind of exercise that they get is during their work hours. And really, if they could just maybe 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening, walk, you know, and get their heart rate to a certain level, you know, that's going to help them to be more successful. But I think first and foremost, we have to start with education. You know, why you should eat these things, what it does for your body, why you should not eat these things, what it does for your body, and you know, how we can use medication to help us. But, you know, the things that we fuel our body with, that's going to be the best medicine for us.
Anyone? Mark?
I work in healthcare, but obviously I'm on the administrative side. I'm not like Dr. Ellis, and I probably can't contribute as well as she could. But, you know, we talk about the foods and stuff that we eat, and also it's the drinks. And I know we keep talking about food, but, you know, drinks are another part of that food intake. And what we see too many times is the amount of sugary drinks that we're consuming and the availability of those to school age children, the middle school and the high school, and they put soda machines in schools. And I don't know if that is still a problem now or not, but that's one thing we're finding here. I've seen people in our lunchroom that would grab a salad and you think they're eating healthy, and then they have a Mountain Dew or a Coca-Cola or something that just, you know, is not that healthy. And that's another thing that we're seeing, because when you have these Dollar General stores and these other stores like that pop up, which they are here in Boone County, there's like 3 new ones that they're popping up in the more rural areas. And that's what we're finding. They're selling the sugary drinks, they're selling the canned products. And one thing I know, Dr. Ellis, I apologize, my biggest problem is sodium intake. I have hypertension, I have to watch that. But sodium is another thing. All your canned food, all your processed foods, everything is loaded with sodium. And so, yes, education, I agree. Education is key to letting these people know, because it looks healthy doesn't mean it is.
Thanks, Mark. Dr. Ellis?
I just want to follow up with that. You know, and a lot of people don't realize, you know, the things that they substitute for may also cause problems. So we have people who stop using sodium and then they use something like Mrs. Dash, and then their potassium's out of whack. And when your potassium's out of whack, it can cause, you know, a lot of heart issues and things like that. But I just wanted to drop a link here in the chat box of a project that we're working on with Wild, Wonderful, and Healthy Logan County. It's actually addressing water intake over sugary beverages. And what we've been able to do with that, we are getting to the schools. We're giving this little education video, and and we are actually providing each of the students with a water bottle so they can use it at the refillable water bottle stations in their school. So what we're doing is giving them the choice to make the healthy choice to drink water, so that they have that when they're at home. You know, and a lot of times, you know, if your kids learn something interesting at home, they'll go and tell their parents. So, you know, that's something we're really excited about with Wild, Wonderful, and Healthy Logan County. If you get a chance to check that out, our video there. But, you know, it's multifaceted, the things that we can address. But like I said, just first, you got to start with education, because people generally do not know.
Right, great, thank you. I'm going to jump to, let me see, we have about 15 minutes left. So I'm going to get to some questions in the chat. If you have access to the chat right now, it seems as if it's been hopping since we started the discussion. So I'm going to wade through it and see if there are questions or comments to share with everyone. But I find one from Carla that says, do you have any suggestions for improving cold storage capacity for fresh foods at food pantries? Can any ARP funding be diverted for this? Do we know?
I know we at Hungry Lambs, we were able to receive a grant through United Way, that United Way out of Charleston, that helped us purchase 4 restaurant grade. 2 were refrigerators and 2 were freezers, restaurant freezers that we used. But we are fortunate enough that we do have a walk-in freezer and a walk-in refrigerator too, but we found ourselves in need of more. So there are some grants out there that you can get that will help you purchase things like that.
Great. And if we find any more information when we post this video and materials online on Monday, we will share those links with you. And we have some wonderful comments in the chat. We're not going to be able to get to them all. I see we have 6 new ones. People seem to really like the idea, Delegate Lovejoy, of called it a nourishment office at the governor's office, which sounds wonderful. We haven't talked about 211, which is United Way's centralized number, which is a wonderful resource that sometimes goes underutilized. We found when we started working on this project that a number of pantries are not listed in it. So it was one of our recommendations to try and get all pantries and resources into 211 so it can be the best resource that it can be. We know that 201 is partnering with Aunt Bertha, which is the name of a platform software, and Unicare works with it as well, but I believe they're piloting a program, and we can share information about this, to have resources actually printed out on somebody's take-home information from their doctor's office. They can work with electronic health records, so we can make that connection between the healthcare system and local resources. Ashley says she would mention that some big box retailers now participate in the SNAP online purchasing project. Some of those retailers, such as Walmart and Amazon, will do front door delivery for a small fee. That sounds really interesting, so we'll make sure and share that information as well. Let me see. I don't see links in the chat. We'll share them on Monday. And Dr. Ellis did share 2 links. And Cindy Fitch, who is with WVU Extension, says she fully supports education on healthy foods, but we know that learning alone is not often enough to change behavior. We need to help change the environment and help make healthy choices easy and routine, which I think policy can help in that regard. Those are all the questions that I see here. So I'm going to jump back to a couple of more and see if anyone else has more to share. So how can we, to all panelists, how can we, your audience, the general public, help those of you who address health and hunger do what you do to improve the health of your communities? What would you like from us?
I guess the best thing I can say is just reach out to your local food pantry and ask and see what your local food pantry would need, as far as maybe volunteer or monetary donations, or I mean anything. Just, don't be afraid to reach out to you.
So Chad, I remember your session during the series where we talked about the fact that a number of programs like yours, like your wife's, rely on grant funding. So almost every year we've got to write this really long grant and, cross our fingers that we get funded again. And so if it were possible to have some sort of steady seed funding to keep our pantries going, that would be beneficial as well, correct?
Yes, that would be great. It's very stressful writing grants. Some are simple, but then the ones that are rather large grants, I mean, there's a lot of little details that you have to have exactly right. And one little thing is, if this T's not crossed and this I's not dotted, it's thrown out. So it's very, very stressful with grants. So yeah, it would be very helpful with that.
Anyone else have any other things they would like to ask of the public? What can we do to help you do what you do better? Okay, well, I think that we learned a lot from a report that'll be available in print and is already online, and I'll put the link on Monday, of some of the other recommendations that came up during our session series. And I think addressing stigma is one of the biggest things that we can do to help ensure that people are accessing resources. We can get better at communicating and collaborating on that local level. And we could use some incentives to make that happen. I see from Carla, she says the pharmacy program and other farm to clinic access programs like Farm to You program in the Eastern Panhandle are mostly supported by grant funding. What is the best way to ensure these programs continue to serve West Virginia sustainably to allow for long-term health impacts? Our goal is advocating for state Medicaid funding. What are y'all's thoughts on that?
Kelly, I would say, I think that is a good goal through the state Medicaid, but I also would remind or be mindful that with the ARP money, we have money to the state, which is, a lot, but there's also, for the first time, monies directly coming to counties and municipalities. And I know here in Huntington, I've sat down with my mayor and said, I know you have a lot of great ideas, and I've also talked with my commissioners, but please make sure that those who are most vulnerable and most affected are at the table. And so, I would like you to commit to some reasonable amount of your planning go to those efforts. So I would say the state, but don't forget your counties. If you're in a city, don't forget your city, and also, don't hesitate to reach out to your federal counterparts, because there is money right now that we have not seen before, but we're in a problem we've never seen before. But just this is an opportunity, I think, to make those requests.
That's a wonderful point. Thank you, Delegate Lovejoy. And I also would say this, Carla, oftentimes there are really great programs that happen on the community level that unfortunately go away when the grant goes away. And so, sharing the results of your program with your legislators is always a really smart thing to do, as well as sharing it with your local county commission, your city councils. Let them know of the good things that's going on, because oftentimes, if you're not the one who's getting it in front of them, they're not going to know that it's there.
A lot of times too, we have in Lincoln and a lot of my surrounding counties, pop-up farmers markets, not really an established building or long, so it is local vendors that are showing up, a lot selling individually. There is an opportunity for our producers to be able to receive SNAP benefits on site, but there are also a lot of hoops and regulations that are sometimes difficult for our local producers to be able to navigate that, or even making that clearly identifying what those steps are. I do think if there's some way to have, introduce that conversation into how can we make that more accessible, because we do have, there are a lot of opportunities with some of the pop-up markets that can support getting local fresh produce to our families if we can help with that, bridge that gap.
Thank you, David. And thank you for adding that now, because we'll articulate that in the notes when we get that out. I see Delegate Lovejoy put in the chat, please send along any food insecurity policy ideas, comments, or criticism that you would like to be forwarded to the entire House Food Insecurity Workbook group. And he shared his email and his personal cell. And so we'll be sharing that with you as well, which thank you very much for that, Delegate Lovejoy. So I'll open it to any final comments from attendees or panelists.
Hey, I just wanted to say, the biggest thing is boots on the ground. So you have to get out there in your community in order to know the needs. A lot of the collaboration that we've been able to do with Chad and with Hungry Lambs, that started from, our church just going and meeting with him and his wife and seeing what the needs were in the community. And, I was able to connect them with Wild, Wonderful, and Healthy Logan County. And then some of the church needs that the church were able to take care of, they can do that. But you're not going to know what the needs are unless you assess your community and the needs that you think that the community may have. It may be something totally different. So you have to get out there and you have to talk to the residents.
Wonderful point. Thank you for sharing that. And another, go ahead, Mark.
Well, just to elaborate on what Dr. Ellis said there, that goes back to the idea that Delegate Lovejoy had of putting a county-wide nutrition officer or someone in each county. And I think, again, one of the things that I think we've all learned from this process is the resources. Where are they at? How much is available? Where can we get distribution points, and then getting it out to the needs, like in the areas like Delegate Walker mentioned earlier about getting to the people who need it. So yeah, there's a tier process, and I think we've identified a lot of those, and I think we've also come up with some resolutions to those, and I look forward to being part of that process to help see that come true.
Thank you, Mark. Okay. If no one has, I will say this, and then I'll move on to close up. I think that we owe a lot to the faith-based community, our churches around the state, because they really are carrying a lot of the work to ensure that people aren't going hungry in our state. And so I really look forward to working with them in the coming year and hearing what they have to say about what is needed, because I think nobody's going to know better than them. So we are at the end of today's session. Many thanks to our panelists, the Palatine Foundation of Huntington, and our attendees for the great conversation today. For those of you who registered and attended today, you will receive a link on Monday to this YouTube video, and it'll have links to the resources that were mentioned in the chat and in the discussion. And we'll be recapping this and sharing it on our blog on our website. So again, thanks for joining us. Have a great weekend, everyone. Bye-bye.